Welcome back to the Medicinal Herbs podcast. This month, we're talking with naturopath and herbalist Joe Boyd about herbal safety, including safe herbs for children and pregnant women, how misinformation can plant the seed of doubt, and how to utilize herbs safely and confidently.
We're excited to have Joe Boyd back to talk about a really important topic that comes up in conversation often. Often we hear people say, "Oh, I don't want to do herbs. I'm not sure if they're safe. I'm just not really I'm kind of scared about it." But let's start, Joe. First of all, thank you for joining us again. It's always
Thanks
great
for
to
having
have
me.
you. We want to start thinking about why is there this misconception sometimes with people that maybe herbs aren't safe?
Look, I think, that can be for, many reasons. Part of it is that there is this whole host of misinformation out there in regards to
Mhm.
herbal safety. I also think that if people are not confident and haven't been using herbs, maybe there is that little bit of a fear of the unknown. And I also think that much of the time it can be media driven as well. And I think if we come back to the fact that herbs have been used safely and successfully for thousands and thousands of years, it's a really good starting point, because we know that there's this great clinical value of using herbs, and they can really help, our patients achieve their wellness goals and experience really great health. But of course, at the same time, as healthcare practitioners, of course, we want to do no harm. And like, foods, herbs are naturally complex substances. They contain many different compounds and phytochemicals. And I think while we can clearly recognize that, herbal medicines are widely considered to be a very low risk, at the end of the day, they're not going to be completely free from the possibility of perhaps toxicity or adverse effects. So I think for us, to be truly conversant and effective herbal clinicians, we need to be well versed in all aspects of herbal safety. And I think a key aspect for this, and I really want to reiterate this point time and time again with the doctors or the listeners of this call, we can't be expected to know everything all of the time. And I think knowing the right resources to turn to in regards to herbal safety is a really good starting point. Resources that are backed up by not only clinical evidence, but also people who will be using herbs in their clinic, and looking at the realistic assessments of risk, and be well educated in relation to herb drug interactions, as there's a lot of inaccuracies and a lot of misinformation out there. And I remember a little while ago listening to Kerry Bone talk about the misinformation in regards to herbs and herbal safety. And he said, if the herbs in this world could speak, they'd be suing us for defamation. And I kind of think that says it all. And I would really also say to the listeners, we need to choose our herbs wisely, right? So what I mean by this is choosing from herbs and herbal products from companies that we can trust, not only ensuring that we've got a great quality product that's going to be efficacious, but also a herbal product that's going to be safe as well. Because I think we'd be naive to think that it's all sunshine and roses in regards to herbal medicine manufacturing. So, there are some suppliers out there who perhaps quality is not their number one criteria. And I think any company at the end of the day can have all of this fancy equipment to do the herbal medicine testing, but it's about having the right team of people to actually do that testing, to know what to test for, what to look for, what are the important markers, how to identify if in fact there is something that is not quite right with the herb, because we do see issues of substitution and adulteration,
Mhm.
and that can go on to have a safety implication for us.
For sure. Obviously, knowing what herb you're giving is
Yeah.
important. And especially when you kind of think of this drug herb
Hmm.
interaction, and people are really concerned with that, right?
Yeah.
And there's a bit of misinformation. So, how do you address kind of that bit of information that's out there, but then also making sure that, if there is a real concern, that they're appropriately addressing that?
Yeah, absolutely. And I think that's a really valid point. And I think it's quite understandable, particularly if, you haven't used herbs a lot and are not well versed in herbs, because misinformation does abound in relation to herbal medicine. And often what we find is the information perhaps is not even from a primary source, or, there's misinformation even on so-called reliable websites and in authoritative texts. Often what we find is it's not based on an appropriate likelihood of risk. It seems to
Mhm.
be that we're getting, assume the worst case scenario. It's always going to be the herb. So sometimes, even that can be purely theoretical. And the information can contain mistakes. So in regards to herb-drug interactions, it is something that we really need to be on top of, but we also need to realize that there is misinformation. And a great example that I like to talk about is, this beautiful herb chamomile, which I'm sure all the listeners are familiar with. Perhaps they've had a lovely cup of chamomile tea at night to relax and wind down and encourage healthy sleep. And chamomile, if you think about chamomile, it's a very sweet, it's a very gentle herb. It's considered to be the quintessential herb for children and even infants. So you think, oh, this is a really safe and effective herb. So some information that is on what people may think is a reliable website. There's some very, very interesting information in regards to chamomile and herb-drug interactions. So firstly, when you have a look at it, it's not from a primary source. And then secondly, the information is very contradictory. So they start off in one paragraph by saying chamomile may have mild, very mild blood thinning effects. Not true. And this is usually in high doses for long periods of time. And then in another paragraph, they say things like, if you take any drugs regularly, talk to your doctor about chamomile, because all of a sudden there can be all of these contraindications and herb-drug interactions. So they say it may interact with blood thinning medication, but also sedatives and painkillers and all these other drugs. And they just list other drugs. So that within itself is a very broad statement.
Mhm.
And then they also talk about herbs that chamomile could interact with. So unfortunately, all of a sudden we have this sweet, very gentle herb that's going about its own business, helping people in a really lovely way. All of a sudden we look at that information and it plants that seed of doubt, thinking chamomile potentially could be a dangerous herb. And I think another thing, Sarah, that, I mentioned initially, that we can't be naive in thinking that all herbs are going to be safe and without the potential of perhaps an adverse reaction. And I would have to really stress an adverse reaction with herbs is it's really rare, but there's a lot of misinformation once again and a lot of warnings out there about herbs. And we know what can happen with some patients is they might experience what they think is an adverse react. And of course they think, oh, that's a herb, it's the herb. In many cases, what we can do is we can do a de-challenge and re-challenge, and this can help to clarify that. So maybe take people off the herb for 3 days, 5 days, or a week, and then reintroduce it and maybe start at a smaller dose and see if in fact it's the herb. And I think you'll find more often than not, it's not going to be the herb. But we do need to be aware of, very sensitive to patients, it's sometimes best to start with a lower dose of herbs. And we know with some herbs, some of the reactions that people may have are predictable. So herbs like horse chestnut that are rich in saponins, they can cause a bit of esophageal reflux in sensitive people. So this is why you'd always want to use an enterically coated tablet. Things like forskolin, the active constituent in coleus, could stimulate bowel motility. So it's not that someone's having a reaction to the herb. That's a natural consequence of coleus, which sometimes is not a bad thing. But what we can do in that situation is start at a lower dose and then gradually build up, so people build up tolerance. So it's not that the herbs, it's this intense or severe reaction to the herb. It's actually a natural reaction to some of the active constituents.
So you were talking about chamomile, and I love Angela refers to it as a mother's hug.
Yeah.
But you and I have talked about, chamomile and its benefits. Maybe if we could just touch about how you would use it safely with both children and infants. I know we were talking about infants earlier because maybe our
Yeah.
mastermind has a new infant, so it'll be good to address that.
Yeah, and congratulations again, Cara. And every time you talk about chamomile being like a mother's hug, I always kind of feel this warmth and relaxation just thinking about it.
Mhm.
So herbs, and I know we've talked about this before, about herbs and children being this amazing pairing. Both of my children have been taking herbs from a very, very young age. And I think if prescribed by a qualified healthcare professional, yes, absolutely, herbs are going to be safe for children. And in fact, what we find is children typically respond really quickly to herbal medicine. They've got so much more vitality than I think, some of us older people tend to have. And they do have this beautiful long history for not only helping children, but helping whole families to thrive and, to be healthy. I think one of the reasons, and you talked earlier about why people may have a little bit of a fear in regards to herbs and herbal safety. I think in regards to kids or children, one of the reasons might be that we're really not taught in college or university about herbal pediatrics. And I think we need to understand that children are not just miniature adults, right? So they can respond differently to herbs in regards to how bioavailable a particular herb might be, how they break it down, how it's absorbed. They may react to different herbal actives. I think an important thing that we need to talk about when we're talking about herbs always is to get the dosage right. So, and I know you mentioned last time there's some information available on Holistic Matters about children's dosing. Great.
Yes.
So with children's dosing, what we used to do traditionally was from the age of 12 and onwards, that was considered to be an adult's dose. So for a 6-year-old, you'd halve that dose, a 3-year-old would be a quarter of the dose, and so forth. But what we're now finding is that, children, say the age of 8, are weighing the amount of a 16-year-old, for example. So I think a better rule or a better guideline is to look at body weight to actually ascertain what the correct dosage or percentage of an adult dosage the children can take. So we do that from kids from 2 to 12 years of age. And then for the little ones, for the infants, and as I said, my little ones have been taking herbs since they were 3 and 4 months old for various reasons. We need to get the dosing right. So what we actually do is we look at the months, how old they are in regards to their months, and then we dose that appropriately as well. And I really want to stress with infants, we really need to be using the more gentle herbs like chamomile. I think echinacea and eyebright, for those of you who have little ones in childcare, is a great combination for all of those germs and things that they can get. And also our lovely herbs to support nervous system function, the chamomile, skullcap and passion flower, all of those are absolutely beautiful for children. So I think if we follow simple guidelines and follow and practice common sense, we really can have a great impact and really help children in regards to supporting their health and well-being, and avoiding powerful herbs or powerful laxatives, I should say, such as senna, or use it with caution. Potentially toxic herbs, you're not going to be using poke root with little ones. So I think we need to do our due diligence and make sure that the herbs are going to be okay, but please don't rule out all herbs with children and infants.
So talking about another kind of sensitive group is pregnancy. And,
Yes.
as we think about safety, obviously, we really want to be safe when we're talking about individuals who are pregnant. And we often see kind of that warning on the label. And how do we kind of, work through that? And let's talk a little bit about which herbs would be appropriate then.
Yeah. Oh, look, I really think that some of it comes from, as you said, the warnings on labels, and we need to have a look at the labels and understand them. I think that's a good starting point, because what you might see on a label is it might say outright contraindicated in pregnancy, which means no, we can't use it. But the key to look for is if maybe it says cautioned unless otherwise prescribed by a healthcare professional, or cautioned under medical supervision, or whatever that might be. But if we look at that word caution, what it might mean is some herbs can be used the 3rd trimester of pregnancy and not in the 1st trimester of pregnancy. Or it may be that there is some random bit of anecdotal information that says that you can't use that herb. So we always need to know what we're doing and know the references to look for to work out if a herb is safe. And I would say I only use herbs in pregnancy if absolutely necessary. So just because a woman is pregnant, though, it doesn't mean that all herbs are absolutely contraindicated. And I have to say, for me, herbal support really saved me in many situations throughout, both of my pregnancies. So when we're having a look at the risk, and we must, look at the risk benefit situation as well, we need to work out, is there potential toxicity to the mother, which can, indirectly impact the health or the development of the child? Is it there going to be a potential toxicity to the child called fetotoxicity? Or could it contribute to any type of developmental, malformations or increased risk of miscarriage? There are certainly herbs that you can use to support a healthy and viable pregnancy, though. As I said, only use what's truly needed and make sure you do your due diligence to ensure that you're using a herb that's going to be safe. Be particularly cautious in that first trimester, I would have to say, and be particularly cautious if there is perhaps a history of miscarriage. And of course, we're going to avoid toxic herbs and laxative herbs. I do want to say, though, that often in that third trimester, some women may tend to be constipated. Often what we find is they may be on an iron supplement, perhaps, because that third trimester is when, the babies will really suck all the iron out of the mother. And if they're on iron tablets that are not from a herbal or whole food support, that has the potential to cause constipation. So this is when we may think of herbal support, herbal laxative support in that scenario. I don't recommend using any herbs or herbs containing essential oils or pure volatile essential oils internally during pregnancy as well. And I would say be informed. If you're not comfortable and confident in using herbs with pregnant women, then I would recommend partnering up with someone who is and getting them to mentor you or referring them on as well. I think there's some great information in Kerry Bone and Simon Mill's book. It's called the Herbal Safety Book. I don't know if you've seen it, Sarah, but there's
Oh, it's on my desk.
Awesome. And this is a great resource for herbs in pregnancy, because what I love about it, there's a section there that talks about the level of risk. So there's 5 different levels of risk. And then when you go and have a look at the Materia Medica, it will actually not just say, oh, it's cautioned in pregnancy or it's outright contraindicated. It will tell you the reasons why and that level of risk. So I do think it's all about being confident and knowing what you're doing and choosing herbs that are going to be, safe and supportive for the mother and the baby.
Mm-hmm. We were talking earlier a little bit about drug-herb interaction. And as we think about that, there are a lot of people across the world, but specifically here in the United States, that especially over the last 2 years have had concerns with depression and anxiety and are taking medications around that. And so there often is a drug herb interaction that people are concerned with. Could you kind of address that and where you kind of need to be more safe? Well, you should always be safe, but where you need to be more cautious, and where, you can really find an opportunity to make sure that you're meeting the needs of the patient, and maybe herbs can, help in that area.
Oh, absolutely. And I think that, this is a key driver in regards to concerns for using herbs. And when you think about it in the US, and, it's the same here in Australia, it's fair to say that more drugs and more combinations of drugs are being used to treat patients than ever before. So this is something that we really need to get on top of. I don't think we can be expected to know every single herb drug interaction that is out there. But once again, it's finding credible resources and references to use, like, the Herbal Safety Book. And what you'll see is that interactions can be one of 2 things, or it could be a combination of 2 things. So we can have what we call a pharmacodynamic interaction. And this is where the herb will potentially interfere with the action of the drug. And sometimes this, in fact, can be useful and clinically beneficial. So if you think about drugs and herbs that potentially can lower blood sugar, for example, what they can do is they can, in fact, work synergistically together. And what we then might be able to do is perhaps adjust the level of the medication. Or, if some people are wanting to wean off medication, then we can use herbal support to assist them in doing that in a safe way. So it's really about looking at and ascertaining that risk benefit scenario. So if much of the information is theoretical and based on perceptions of how the herbs might work, if it says that this could cause great harm, then absolutely we're going to be very cautious about using it. But if it's only a minor concern, it makes absolutely no sense for that to be an outright contraindication. And then we have the second type of interaction that we might see, and that's called a pharmacokinetic or a PKI interaction. And this can be a potentially serious issue. So it's where the herb can potentially change the absorption, the metabolism, or the excretion of the drug, which will lead to an altered activity of the drug. So be it an increased activity or a decreased activity. So it's looking at, drug metabolizing enzymes. It's looking at altering absorption and bioavailability and also drug elimination. So this will happen in the intestines, the liver, the stomach, transport in the blood, the kidneys, and so forth. So coming back to your question about, what we can do to perhaps minimize or avoid herb drug interactions, I think there are some very simple things that we can do. Firstly, we do need to be careful of drugs that have that narrow therapeutic window, like your digoxin and warfarin medication. I think we need to be mindful of the elderly, because what we see in the elderly is they do have an altered digestion, absorption, and metabolism. So that's something that, we need to be aware of, or people who may have impaired liver or kidney function, of course. And I think, a common sense approach would be if someone wants to take a drug and a herb, just take them at different times of the day. At least 2 hours apart, I think, is a really good starting point. And for surgery, stop all herbs 1 week before surgery as a precaution, and ask your patients if they suspect any herb drug interactions to, of course, report them to you. And I think, once again, as I keep saying, we can't be expected to know everything. So know where to find that credible information in regards to herb drug interactions. And talking about Kerry's book, again, there is some great information there in regards to herb drug interactions, because he lists the herb and then the potential interactions with drugs. But if you've got a patient that comes into you on a particular drug, you don't want to have to go through every single herb. We just don't have the time for that. So he does sort of the flip side of that. So he lists the drug and then he lists all the potential herbs. And once again, it's about that level of risk. It might be that it's an outright contraindication, or it might be monitor low level of risk, high level of risk, or very low level of risk. So once again, find that credible information to use as your reference.
You mentioned warfarin, and so often people are concerned with their anticoagulants and medication, and we know specifically warfarin. People often are concerned about how to take herbs if they are taking that. And we get a lot of comments in our helpline about ginkgo biloba specifically. And so how would you talk to somebody about people who want to take ginkgo, but then, are also on an anticoagulant?
Yeah. This is one that I think there is some misunderstanding out there in regards to ginkgo and anticoagulants. There certainly are herbs that have that outright contraindication in regards to, people on anticoagulant and blood thinning medication. Ginger is one of them, but that's at high doses, and St. John's wort is another one as well, because of the potential of that pharmacokinetic interaction. Then we have other herbs that may be a medium level of risk. Wormwood is, I think, a surprising one, but something to be aware of. And then there's a whole host of herbs that are low level of risk or very low level of risk. And this is where the herbs such as the ginkgo and the garlic and the willow bark, that's where they fall into that category. And in regards to ginkgo and potential interactions, Kerry, I remember listening to Kerry one day talk about this, and he said he was so over this mantra of people saying you can't take ginkgo when you're on blood thinning medication that he actually wrote a paper on it. And the paper was titled something like the potential interaction of ginkgo biloba with antiplatelet and anticoagulant medication. And I believe it was back in 2008, if anyone wants to have a look at it. In relation to this issue or potential issue with ginkgo, when you have a look at the information that's out there, there's little evidence to support it. So the confusion comes with the fact that ginkgo can potentially inhibit PAF or platelet activation factor. Now, in rabbits, so not in humans, in rabbits, this pathway, it's a significant pathway for platelet activation and blood thinning activity. It's not the case in humans. So it does one thing in rabbits and something different in humans, which is why we always need to interpret the information that's presented to us. So in humans, this pathway is more about having an anti-inflammatory activity and has no impact on platelet function. So I think in regards to ginkgo, we can't rule out the potential that there may be an idiosyncratic reaction, and we can never rule out the potential for an idiosyncratic reaction really with both herbs and drugs. But I would say that you can really confidently give ginkgo without hesitation, because it is a situation where, of course, we need to monitor it, but there is a very, very low level of risk. And this also brings up an important discussion about surgery as well. So we say to avoid any potential complications, and this is really about being cautious, which is what we want to do. Avoid all herbs, not just the potentially blood thinning herbs. We want to absolutely avoid those, but I say just a week before surgery or 10 days before surgery, avoid all herbs really to avoid any potential interactions. There are some herbs that I think can be very beneficial on the other side in regards to minimizing the effects of general anesthesia, such as, of course, milk thistle. And then there are some amazing herbs to promote healing, like gotu kola. So there are perhaps some exceptions to the rule, but overall I'd say avoid them a week before. I think another important discussion is in relation to St. John's wort. And I don't know if it's something that you get asked a lot on the clinic support line in regards to St. John's wort and herb drug interactions. Is that something that comes up a bit?
Yes, it definitely comes up a bit. And, people get a bit nervous, especially if they are on antidepressants or others, if they should, use St. John's wort also. Yeah, for sure. SSRI specifically.
Yeah. And I can absolutely understand that. And I think that once again, it does tie into this whole misinformation in regards to herbs. And if you have a look at credible information out there, what you'll find is that with St. John's wort, it will be in regards to antidepressant medication, such as your SSRIs, it will be a monitor. There's a low level of risk or there's a very low level of risk. And with St. John's wort, I think it is a herb that we can confidently in many situations co-prescribe, in fact, with antidepressant medication to improve clinical outcomes, to maybe get the patient on a lower dose of the drugs, or if they want to, wean off that medication, St. John's wort is a great support. There's a particular active constituent or phytochemical, if you want to call it that, in St. John's wort called hyperforin. And it's this hyperforin that we believe to be responsible for any potential herb drug interactions with antidepressant medication. Now, hyperforin, in fact, is a highly unstable phytochemical. And if you've got, say, a liquid St. John's wort extract that is using a 45% alcohol extraction method, what you'll find is there's really not much, if any, hyperforin in there because it is so unstable. If you're using a higher percentage alcohol extract, for example, a 60% alcohol extract, what you'll find is that the hyperforin may stay in there for 6 months or maybe at most a year. And then you'll find that it will no longer, in fact, be in that liquid. So for some dry extracts, for example, tablet or capsule extracts of St. John's wort, perhaps there may be some of that hyperforin extracted in there, but potentially it could be quite minimal yet again. So I think what we can do, the safest option really is to perhaps use St. John's wort in combination with other supportive herbs. So we're having a lower dose of overall St. John's wort. But this whole issue about St. John's wort causing serotonin syndrome if people are on SSRIs is just, in fact, it's not the case. When you have a look at how St. John's wort works, it's different. It doesn't work like your SSRI. So there's no potential for it to actually cause serotonin syndrome. In fact, if it's going to do anything, it could potentially lessen the effect of the drug. So, you know, we're still kind of understanding how St. John's wort works, but we know there's research out there to say it doesn't work like your tricyclics or your SSRI medications. So really, at the end of the day, I think if it's clinically appropriate, then we can use St. John's wort combined with antidepressant medications under supervision. I would recommend starting at a lower dose, and I would recommend talking and educating your patients about St. John's wort, because we really want them to feel comfortable and confident as well. So we need to, you know, ensure that they're on board as well, so they're comfortable with what you're giving them, which is so important.
Yeah, I mean, it is a little bit complex, but if you kind of take it piece by piece, you can really help the patient to understand where and when it is appropriate to use that herbs
and I've
and
totally
interaction.
and look, you know, I've totally simplified it, Sarah.
Right.
But there is a lot of information available out there in regards to, you know, St. John's wort. And as always, we need to be aware of the potential herb drug interactions and mindful of it. And I've possibly oversimplified it today, but I just don't want it to be this outright blank fear of not using St. John's wort in that situation.
For sure. So as we kind of wrap up, is there anything else that you'd like to add to the discussion? I mean, we could really be discussing herb safety for the next, you know, week if we wanted to, and we probably still would only get through a really small section. But you know, as our limited time, what would be those kind of you know, final words that you'd like to share?
Look, I really hope today's somewhat brief discussion in regards to herbal safety has perhaps opened doors for some of the listeners who perhaps had this prescribing barrier in regards to, you know, herbs and herbal safety. And I really hope that now, you know, you can experience that remarkable healing potential that we know herbs have, not only for our patients, but for ourselves as well. And I think when you're looking at the information out there, look at it with a very keen eye and ask yourself a couple of, you know, really simple questions in regards to herb drug interactions or herbal safety. Think about it and ask questions like, is it a coincidence? Is it an idiosyncratic situation? Is there a potential for this to actually be a substituted or adulterated product? Is it a PDI or a PKI interaction? Or even, you know, is it in vitro or in vivo research? Is there enough evidence to actually support the warning that's out there? And is that from a credible source? You know, and I think the more we can surround ourselves with people who, you know, are using herbs in practice, that can only really help to build our confidence. And I would say and remind people that herbal therapies has its roots in absolutely every culture in the world, and it's done so for thousands and thousands of years. I think it's really interesting that from a Western perspective and in the Western world, we for some reason consider natural therapies as this deviation from the norm. But when we think about it and we reflect, we realize that, in fact, herbs have been practiced for thousands of years in a safe and effective way, and in fact have been the earliest form of healing. So, you know, please don't fear herbs, my friends. And I hope that, you know, we can all be enjoying the amazing attributes of them in a very effective and safe way.
Yes, right. I mean, there's so many opportunities. And, you know, as we just think about it, we just need to be mindful. But there's so many amazing herbs out there that can really have a life-changing opportunity for many of our patients.
Absolutely.
Thank you so much, Joe. It's always a pleasure to have a conversation and dive deep into herbs with you. I really appreciate it. Thanks so much.
Thanks so much, Sara.
Thank you for listening to the Medicinal Herbs podcast. For more resources on safely utilizing herbs for children during pregnancy, and also for lactation and breastfeeding, visit WholisticMatters.com. That's holistic with a W.